Welcome to the Deep Dive. Today we're tackling a really interesting area of canine health, one that I think hits close to home for a lot of people.
Mm-hmm.
It's an inherited muscle condition, specifically affecting Labrador Retrievers.
That's right. Yeah.
We've got some detailed information here about what was originally called Labrador Retriever myopathy. Our goal is really to, get under the skin of this condition.
Yeah, understand it properly.
Exactly. What is it? How does it show up? And what does it actually mean for owners and breeders too?
And what's fascinating right off the bat is, well, how our understanding has shifted over time.
Oh, how so?
Well, early on, based on the symptoms and what they saw under the microscope, people thought it might actually be a nerve problem, a neurogenic thing.
Okay. Not muscle.
Not primarily, or so they thought initially. It's only more recently it's been confirmed as, a primary muscle issue. It's even got a new name now, Centronuclear Myopathy. CNM, for short.
CNM. Got it.
And, even though we've identified the gene responsible, the precise way it causes all the muscle problems, that's actually still a bit unclear, still being researched.
Huh. Okay, so this Labrador Retriever myopathy, now called CNM, sounds pretty significant for the breed. What exactly is going on at a fundamental level?
So at its core, it's an inherited muscle disease. We see it specifically in Labradors, really all over the world.
Inherited. Okay.
Yes, that's the key. It follows a pattern called autosomal recessive inheritance.
Right, autosomal recessive, meaning?
It basically means the dog needs to inherit 2 copies of the faulty gene, one from its mother, one from its father, to actually show signs of the disease.
Ah, okay, like you need both ingredients.
Exactly. If they only get 1 copy, they're a carrier, but they won't typically show the symptoms themselves. And we know the gene involved now. It's called PTPLA.
PTPLA, okay. You mentioned that initial confusion, though, that it looked like a nerve issue. What was it about the early signs that pointed that way?
Yeah, that's a good question. The material points out that affected dogs often lose their tendon reflexes, like the knee-jerk reaction.
Right.
That and some changes they saw when looking at the muscle tissue itself. Well, initially, it kind of suggested a nerve problem was the root cause.
But that wasn't the case.
No. Further digging showed that the actual muscle proteins were normal, and there weren't any structural problems in the central or peripheral nervous systems either.
So the clues were a bit misleading at first.
Exactly. It just highlights how tricky diagnosing these neuromuscular things can be sometimes, Nerve and muscle symptoms can really overlap.
Fascinating. So it's primarily a Labrador issue, but is it only labs?
Mostly, but not quite exclusively. It's worth noting there's a very similar inherited CNM found in Great Danes, too.
Great Danes, interesting.
Yeah, specifically younger Great Danes, both males and females. Finding it in another large breed like that does make you wonder, doesn't it?
Yeah, about shared genetics or vulnerabilities in those types of dogs.
Exactly. Maybe common pathways in muscle development. It could open up avenues for research comparing the breeds.
Right. So we understand the basics, the genetics.
Yeah.
Now, who typically gets this? Which labs, and when do owners usually start seeing something's not quite right?
Well, we tend to see it mainly in black and yellow labs.
Okay, black and yellow predominantly.
Yeah. And the age when signs first appear, it can vary quite a bit. Sometimes as early as 6 weeks, other times maybe not until 7 months old.
Wow, that's a big window.
It is. But most commonly, owners or vets pick up on it when the puppies are around 3 to 4 months old.
And it affects both sexes equally.
Yep. Males and females seem to be affected in equal numbers.
So what kind of signs would an owner actually see in a young lab puppy with CNM? What should they be looking out for?
Again, there's a real range in severity. Some dogs might just seem a little stiff, maybe, a bit of a stilted walk, and they might tire more easily than their litter mates during play.
Okay, sort of mild exercise intolerance.
Right. But on the other end of the spectrum, you can see pretty significant muscle weakness.
What does that look like?
There are some characteristic movements. You might see a sort of bunny hopping gait in the back legs.
Bunny hopping?
Yeah, they move both hind legs together. Also, a noticeable sort of grouping of the head and neck that's called ventriflexion. And sometimes their back might look quite arched.
And posture changes too.
Yes. You might see them standing with their back legs kind of turned inwards at the hocks. We call that cow-hocked.
Okay.
And their front wrists, the carpi, might look like they're dropping down or hyperextended.
That does sound quite noticeable.
Yeah.
And probably worrying for an owner seeing that in a young pup.
Absolutely.
Are there things that make these signs worse? Triggers.
Yes. The information we have definitely points to exercise making it worse. Also excitement and even cold weather.
Cold weather. Huh.
Yeah, cold seems to exacerbate the symptoms, and in some cases, if they're pushed too hard with activity, a dog with CNM might actually collapse.
Collapse. Wow.
Yeah. But the good news, relatively speaking, is that rest usually helps improve things.
Okay. And muscle changes.
Owners might also notice a gradual loss of muscle mass over time. It can be mild or it can be pretty severe. It's often most obvious in the muscles of the upper legs, the proximal limbs, and also the chewing muscles.
Chewing muscles, too.
Yes. And those tendon reflexes we mentioned earlier, they can be all over the place, sometimes normal, sometimes reduced, sometimes completely absent.
And in really severe cases.
While less commonly, you might see dogs unable to stand at all, becoming recumbent, or they might develop megaesophagus.
Which is an enlarged esophagus. Right?
Exactly. So, yeah, a whole constellation of potential signs, some more common than others. It must be tough for an owner watching their energetic lab puppy struggle like that.
Definitely. Now, there's a collection of signs pointing towards CNM, but the resource also mentions differential diagnoses, other conditions that could look similar. Why is thinking about those so important?
Oh, it's absolutely crucial because, some signs overlap with other health problems, and you really need to nail down the right diagnosis to manage it properly.
Makes sense.
So, for instance, in dogs with only mild muscle loss, that exercise intolerance, well, you might mistake it for something like myasthenia gravis, maybe,
Gotcha.
or even heart issues, or maybe orthopedic problems like hip dysplasia. You have to rule those out.
But what about exercise-induced collapse syndrome? That's another one people hear about in labs.
Right, EIC. That's an important differential. But the key difference usually is that with EIC, you don't typically see that progressive muscle loss, the atrophy.
Ah, okay.
And the collapse in EIC generally only happens after really intense, strenuous exercise, not just mild activity.
Got it. So what about when the muscle loss is more significant? What else could be on the table then?
Well, if there's obvious muscle wasting, the list gets broader. We
Okay.
have to think about other types of myopathies. Could be infections causing muscle inflammation, or immune system problems attacking the muscles, metabolic disorders, or even other congenital issues, things they're born with, but maybe not linked to this specific PTPLA gene.
Right.
We also need to consider general lower motor neuron disorders, which are problems with the nerves controlling the muscles.
And the source mentioned something specific about infections in labs.
Yes, interestingly, it notes that labs seem to have a higher risk of infectious myopathy caused by a parasite called Neospora caninum, often from a congenital infection.
Diospora.
Okay. And there have also been reports of congenital muscular dystrophy in Labradors linked to deficiencies in specific muscle proteins like dystrophin or collagen.
So quite a few possibilities to sift through.
Definitely.
Now, you also mentioned X-linked myotubular myopathy earlier, XLMTM. The name sounds similar to centronuclear myopathy, but you stressed it's unrelated. Can you break down that difference for us?
Yes, absolutely. This is a really critical distinction. XLMTM is another type of centronuclear myopathy, meaning it shares some features under the microscope, like those central nuclei.
Okay.
But, and this is the key, it affects young male Labrador Retrievers specifically, and it's caused by a mutation in a totally different gene, the MTM1 gene, not PTPLA.
Different gene, different condition.
Entirely different. And crucially, the progression of XLMTM is usually much, much faster and more severe.
How severe?
We're talking progressive, significant muscle weakness and atrophy appearing very early, usually within the first couple of months of life.
Oh, wow.
And sadly, the prognosis is very poor. Puppies affected by XLMTM often need to be euthanized before they even reach 6 months old because the condition is so debilitating.
That's heartbreaking.
It really is.
Yeah.
So it's absolutely vital to understand that XLMTM, while sharing part of its name, is completely separate from the PTPLA-related CNM we've been focusing on.
That definitely highlights why getting an accurate diagnosis is so paramount.
So how do vets actually go about diagnosing CNM? What tests really help pinpoint it?
Well, several pieces fit together. Routine blood work, for example, might show levels of an enzyme called creatine kinase, or CK.
CK, right. That indicates muscle damage.
Yes, it leaks out when muscle cells are damaged. In CNM, CK levels might be normal, or maybe only slightly to moderately elevated. So it can be a clue, but it's not definitive on its own.
So what is definitive?
The gold standard now is genetic testing, because scientists identified that specific mutation in the PTPLA gene.
The one we talked about earlier.
Exactly. There's now a DNA test available that can confirm if a dog has inherited 2 copies of that mutation. That's the most direct way to diagnose CNM. So a simple DNA test can give a clear answer.
Pretty much, yes. Standard imaging like X-rays or ultrasound, they aren't usually very helpful for diagnosing CNM itself, though they might help rule out other things.
Okay. What about more specialized tests like electromyography or muscle biopsies? Do they play a role?
They certainly can, especially if genetic testing isn't immediately available or if the picture is complex. Electromyography, the EMG.
That measures electrical activity in muscles.
Right. It might show some abnormal spontaneous activity in the muscles. They describe it as complex repetitive discharges, especially in those upper limb muscles and chewing muscles.
But not always.
Correct. In milder cases, the EMG could actually look completely normal.
Okay. And the muscle biopsy, taking a tissue sample.
Yeah, histology, looking at the tissue structure under a microscope that often reveals some key characteristic changes of CNM.
Like what?
Things like muscle fibers varying a lot in size more than they should. Some fibers might be shrunken or atrophied. And a big one is seeing an increased number of nuclei, the cell's control centers, located abnormally in the center of the muscle fiber instead of out at the edge where they normally are. That's where the centronuclear name comes from.
Ah, okay, that makes sense now.
They might also see signs of muscle degeneration and regeneration happening, maybe some scar tissue, fibrosis, and sometimes changes in the ratio of different muscle fiber types, like fewer type 2 fibers or more type 1 fibers.
So biopsy gives structural clues, but the genetic test is the main confirmation.
That's generally the approach now, yes.
Okay. So let's say a dog gets a confirmed diagnosis of CNM. What happens then? What are the management options and what's the sort of long-term outlook?
Well, the tough part is that currently there isn't a specific cure for CNM. There's no treatment that reverses the underlying genetic issue.
Right. No cure.
So management really focuses on supportive care, trying to maintain quality of life and avoiding things that make the symptoms worse.
Like the cold weather you mentioned.
Exactly. Limiting exposure to cold is an important recommendation because it can really worsen their signs.
Okay. And from a breeding perspective?
That's a huge part of managing the condition within the breed. The strong advice is absolutely not to breed affected dogs.
Makes sense.
And also not to breed their parents because we know they must be carriers, even if they look perfectly healthy.
Right, because it's recessive.
Precisely. And ideally avoid breeding their litter mates too, as they have a high chance of being carriers. And certainly don't repeat any mating that has already produced CNM puppies.
So responsible breeding based on genetic status is key.
Absolutely critical to reducing the prevalence of the condition. Even if a lab looks fine but carries one copy of the gene, they can still pass it on. That has huge implications.
Definitely. Are there any medications or maybe supplements that might offer some help?
The information we have does mention one possibility, supplementing with L-carnitine.
L-carnitine, what does that do?
It's involved in energy metabolism in muscle cells. The suggestion is that giving it at a specific dosage might help improve muscle strength in some dogs with CNM.
Might help.
Shouldn't.
Not a definite fix.
No, definitely not guaranteed. Its effectiveness seems to vary quite a bit from dog to dog. It's something to discuss with a vet, but it's not a cure.
Okay, so what about the overall prognosis? What can owners expect long term?
Well, the clinical signs often tend to sort of plateau or stabilize around 1 year of age. They don't necessarily keep getting progressively worse indefinitely.
Oh, that's somewhat positive.
It is. Dogs that have a milder form of CNM can often live reasonably good lives as companion animals. They might even show some improvement in their exercise tolerance as they mature compared to when they were young pups.
So they can adapt to some extent.
It seems so in the milder cases, but there is that important potential complication we need to keep in mind.
The megasophagus.
Right. If a dog develops megasophagus, they're at a significant risk of aspiration pneumonia inhaling food or liquid into the lungs. That can be very serious, even life-threatening.
A serious risk to watch out for then.
Definitely.
Okay, this has been a really, really insightful deep dive into Labrador Retriever myopathy or CNM. Let's just maybe quickly recap the main takeaways we've covered.
Sure. So we've established it's an inherited muscle disease, primarily in labs, though Great Danes have something similar.
Right, inherited.
Caused by a recessive mutation in the PTPLA gene. So a pup needs 2 copies to get it.
One from each parent.
Exactly. The signs can really vary: stiff gait, tiring easily, Muscle weakness and things like exercise, excitement, and cold can make it worse.
Hmm.
And importantly, genetic testing is now the most reliable way to get a firm diagnosis.
The DNA test for the PTPLA mutation.
Yes. And while sadly there's no cure right now, management involves supportive care, avoiding triggers like cold, and crucially, making responsible breeding choices based on genetic testing.
And for you, our listeners, especially if you own or breed Labradors, understanding this condition, CNM, and its genetic basis, it's just so important, isn't it?
Absolutely.
It really gives you the power to make informed decisions both for your individual dog's health and for any breeding plans. Being aware of the signs means you can work with your vet, spot potential issues early, and use that genetic testing to help prevent this from being passed down generation after generation.
And, this whole discussion kind of raises a bigger point to think about. As we get better and better at identifying the genetic basis for diseases like this in our pets, what does that really mean for the future?
Yeah, what are the implications?
Well, identifying this PTPLA gene mutation isn't just about diagnosis, it opens doors, doesn't it? For future research, maybe exploring potential therapies down the line. It really makes you wonder what the next breakthroughs might be in managing and perhaps one day even treating inherited conditions like centronuclear myopathy.